I'm Rosalind Nieves. Welcome to QPTV's Health Corner. I'm going to take you to New York Hospital, Queens to talk to Dr. SORANA SEGAL MAURER, Director of the Dr. James J. Ray Hall Jr. Division of Infectious Diseases, New York Hospital, Queens. She's going to walk us through the steps that will be taken if, and I will say if, they receive a suspected case of Ebola at their facility. Let's go over to New York Hospital, Queens now. I'm at New York Hospital, Queens. Let's go inside. Dr. SEGAL MAURER, thank you so much for taking the time and walking us through the steps today. It's very important for our viewers.
Well, thank you very much for coming here and asking us.
So, if someone comes into the ER with some symptoms, walk us through that whole process. What happens with that patient?
Absolutely, and I really think that our emergency room is going to be on the front line should something happen. As you know, at New York Hospital Queens, we're between two airports, LaGuardia and JFK, and we definitely think that it could be likely that somebody will walk in. So the first thing is preparedness, right? We don't think it's likely, but it's possible, so we need to be prepared. Our ER staff is very much educated. Our nursing staff, the ones who are doing triage, have been told what the symptoms of Ebola are. The New York City Department of Health and the CDC have been instrumental in giving us an idea of who's at risk, what are the symptoms, and then what do we do about it. The other people that we don't think about are security folks, the ones at the front desk, because before you get to triage, people come in asking for directions. So we very much have briefed our security detail as to what the symptoms are and who they need to refer immediately to the triage area.
So let's reiterate the symptoms. Talk about the symptoms. Just go over that briefly.
Yeah, and thank you for asking me, because I think that everyone is really nervous, and I think sort of relaxing and getting information is the most important. There's a difference between exposure and disease. If someone is exposed, that does not necessarily mean they are contagious to anyone else, or it doesn't necessarily mean that they will develop disease. It's people that we tend to be much more vigilant and watch. Now, we're talking about people we think have disease, not somebody who may have been exposed, but somebody with disease. So what do we mean? Fever, muscle aches, headaches, feeling terrible, and having any kind of hemorrhage, losing blood, vomiting, diarrhea, all of these things put together. And the most important thing, because lots of things can do that, travel to an area where there's Ebola.
Definitely.
So that is so important to keep in mind.
So if someone comes to your ER, they're getting directions, of course, from security outside. If they come inside, what's the next step, and what protective measures do you have in place at the hospital to keep everybody safe?
So go to the triage nurse. They've established that we have risk, the symptoms that we went over, and that travel history, which is crucial. That person, the patient now, will be put into a separate room, private room, with everything that they will need for their care in the room, not to be shared with any other patient. So that is that person now in their private room. The staff, on the other hand, will now get alerted that we have a suspected case of Ebola. They now put on what we call protective equipment. So that includes a gown. What we need is a little different in this case. It's an impermeable gown, a gown where fluids can't get through. These patients are sick. They're vomiting, they're having diarrhea, they're bleeding. So we really need to protect ourselves. Gloves, booties that protect shoes from spillage, and a face mask with an eye shield.
That was my next question. So they would have
Let's talk about the face mask, I think. Okay, so I'm glad that that came up, because I want to emphasize for you and the viewers, this is not an airborne disease. This is not like influenza. This is not measles. This is not tuberculosis.
Does the disease survive on surfaces?
So once surfaces are cleaned, it does not survive on surfaces. But if the surfaces are heavily contaminated with body fluids, those body fluids are infectious. Now, I just want to reiterate for the viewers, they see us in a mask.
Definitely.
Because patients may cough, sneeze, they may throw up on us. So that's why we're in a mask, not because it's transmitted by air. Because I think everyone's asked about that.
Yes.
Right.
Are there different strains of Ebola?
So we've had outbreaks with Ebola for many, many decades. There was an outbreak a number of years ago, and years before that, people made movies about these hemorrhagic fevers with these big outbreaks. So this is not new. What's new right now is it's a little bit larger scale than
Okay.
what's been in the past. And what's new is that we have air travel and people get on a plane and can go. So that, I think, is a little more scary for most people when they hear about what's happening.
So should people be nervous if they end up in an ER and there's someone who suspected that they have Ebola and then, in fact, is diagnosed with Ebola? Should those people panic?
Yeah, so I want to emphasize this is not casual contact. So this is not, I know on the flight that everyone is looking at, from Africa to the U.S. and then to another city in the U.S., these are not the folks sitting in the back of the plane or 3 rows over unless they've specifically come in contact with this person or this person's body fluids when they are sick. While they're still incubating, when they're not with a fever and all the symptoms, they're not yet contagious to other people.
And what is that incubation time?
So that is actually a very interesting question because it can be as short as 3 days to about 8 to 10 days, but some have been even up to 21 days. So right now, we have a hard stop at 21 days just to be safe. So any travel with symptoms within a 21-day period, we consider that as possibly high risk.
Okay, let's talk about treatment. If someone comes in and in fact is infected, what is the treatment?
So first we have to make the diagnosis, and that's where the New York City Department of Health and the State Department of Health and the CDC, as we go around the nation, that's where they become crucial because we can't diagnose this in our laboratory. So all the appropriate blood tests have to be taken to the Department of Health. So that's once we made a diagnosis. The treatment really is supportive. What we've read about, there's some experimental medications. They're not readily available. We also don't know how safe they are. Until the FDA says, this is it, we approve this trial protocol, you can now enroll patients, I wouldn't recommend that people start doing all sorts of things, again, without the CDC and the FDA endorsing it. So right now, it's supportive. These folks get very dehydrated, they lose a lot of blood, they need an intensive care unit, and they need fluids and transfusions, and they need lots of prayers and crossed fingers and time.
And what should their family be doing at this time?
So their family at this time is probably engaged with the Department of Health, because if it's a family that's lived with this patient who now has a diagnosis of Ebola, they are probably being quarantined and being watched for those 21 days. So this family needs to stay put. No leaving, no traveling, no sending kids to school. The family all needs to be together while the DOH is watching them for that time period.
Now let's talk about recovery. So now we're up to the next stage of you've been treated, gotten supportive help, and now recovery. You're feeling much better.
Right.
You're starting to feel much better, which that is, of course, the goal.
Right.
Let's talk about that process. Can you still give that virus to someone else during that recovery period?
Yeah, so we think once you have fully recovered, that's pretty much it. And from what we understand is that most people who have Ebola develop some sort of immunity. And there's a lot of interest in defining that immunity, if it's something that can be passed on to others, or if it means that you'll never be infected again with Ebola. So there's a lot of work being done
So a lot more
on
research.
that. A lot more research, and there's a lot that the World Health Organization is doing to try to get a better handle on understanding this.
Is there anything else that you would like to add for our viewers?
Yeah, I think so. I think being very calm, because it's very easy to watch a lot of TV, and it's very easy to get really anxious, but that doesn't help. Calling an emergency room and getting 1,000 calls a day doesn't help anybody.
Right.
I think just really paying attention to what I personally call trusted sites. The news stations, the CDC, the New York City Department of Health, they all have websites. It's easy to check. They get updated almost hourly. And I think really being calm. We talk about Ebola because it's really what's happening now, and it's so dramatic and people are so ill.
Definitely.
Those parts of the world, they get lots of other diseases. They get malaria, they get tuberculosis, lots of things that present in a similar way. So when we're screening our patients, we're also looking for other things.
Okay.
So I just want your viewers to know that when we have travelers, this isn't the one and only thing we see. We see a
Definitely.
lot of diseases, and those are treatable. So I just want people to know that we're looking for other things that are treatable, but we're prepared.
Right.
And I pretty much think the Department of Health and certainly, the media has been very helpful in getting the word out to educate people. More education, the more calm people will be.
What is the origin of the Ebola?
So it has an animal reservoir, and it's thought that Ebola is found in primates and in bats, and it's felt that the crossover to humans is obviously animal contact, and parts of the world, I don't want to sound sarcastic, there's no supermarket, so they go out and get some what's called jungle meat. So it could be, all sorts of apes or whatever that are butchered. So you come in contact with the secretions and the blood of animals.
That are contaminated.
That's right. So bats, all these apes and monkeys, but that's thought to be one of the reservoirs. So by reservoir means that it affects the animals, but not enough to kill them all off.
Right.
So therefore the virus can continue to kind of
like-
smolder.
Not mutate, but smolder.
Yeah, I'm not sure there's been seen such, the way we have seen it with HIV, such extensive mutations and all that, but it's still sort of found in those animal populations. And it's one of the other things that they ask about is contact with animals. So other than being from those parts, but
Right.
butchering animals in West Africa, coming in contact with bats and things like that, and also the funeral, preparing bodies for funerals.
That's interesting.
That's right, because it's family members that do that, and
Right.
and hand washing is not. I think it's more of a Western concept,
Right, and here
in
all-
some areas.
And here, all that stuff is regulated. It has to be done in
That's
a certain
right.
way.
That's right, and
for safety.
That's right, and funeral parlors have very extensive standards of how to handle body fluids.
Right.
But in other parts of the world, it's really the family caring for their deceased loved one, and they're not always adhering to the same, disposing of, the bedding and the clothing and, washing hands after touching.
And that makes sense where they don't
That's
have
right.
that information shared. They don't have a Queens Public Television
Yeah,
to share that
that's right.
information.
That's right.
Actually.
And it's also when you have all sorts of cuts and, your skin may not be intact.
Right.
It's
And you
easier
might not
to
even
penetrate.
realize- You might
That's
not
right.
even realize it. It might be so small, just
That's
like a
right.
paper cut. And then
That's
all
right.
of a sudden you get something that's salty and you're
That's
like, oh
right.
my goodness.
That's right.
When did I do
It's
this?
interesting. There's some older studies that have looked at skin integrity of, I think, various doctors of various professions, where people said, no, my skin's just fine.
Yeah.
And then they actually pour alcohol, dilute alcohol in your skin, and all of a sudden now you notice that you have sort of tiny cuts and nicks that you did
These
not
little
know.
burns.
That's right. So that's the kind of exposure that you worry about.
Thank you. That was great information. Thank you so much for joining me
My
here
pleasure.
today.
Thank you for coming to see us.
That's it for today's program. If you miss any part of this segment, just go to our website at www.qptv.org. I'm Rosalind Nieves, and I'll see you next time on Health Corner. Thank you.